If you're over 70, have you been wondering if you're bathing too much, or not enough? What if I told you that the daily shower routine you've followed your entire life might actually be harming your health now? Getting your bathing routine wrong after 70 can lead to painful skin problems, dangerous falls, and even affect your mood and independence. The truth is, what worked for you at 50 needs to change at 70, and most doctors never explain this. Today, I'm sharing 7 shocking facts about bathing after 70 that will help you stay healthier, safer, and more comfortable. By the end of this video, you'll know exactly how often you should bathe, why your current routine might be risky, and the warning signs in your own habits that you shouldn't ignore. Before we start, comment "learning" if you're here to take better care of your own health, or "caring" if you're watching this for a loved one. And if you're new to Elderly Health Central, hit subscribe. We're here to give you the health information you deserve at every stage of life. Now, let's dive into these 7 shocking facts that could completely change how you think about bathing after 70. I promise you, by the time we're done, you'll look at your shower routine in a whole new way. Let's start with the most surprising one. Fact number 1, your daily shower habit is now damaging your skin. Margaret, 78, came to me frustrated because her skin was constantly itchy, cracking, and bleeding. She'd been taking hot daily showers for 40 years, until we discovered this clean habit was actually destroying her skin. Here's what's happening to your skin after 70, you're producing 50% less natural oil than you did at 40. Those daily showers are now washing away protective oils faster than your body can replace them, leaving your skin vulnerable and prone to painful cracks. You might think daily bathing means better hygiene, but for your aging skin, this cleanliness is actually creating problems. If you're over 70, try bathing 2 to 3 times per week instead of daily. Use gentle, fragrance-free soaps and moisturize immediately after bathing. But it's not just how often you bathe, the temperature of your water is creating a hidden danger. Fact number 2, your hot shower is a fall risk you never considered. Robert, 72, loved his steaming hot morning showers until one day he stepped out feeling dizzy and ended up on his bathroom floor with a concussion. The culprit? That hot water he thought was relaxing. As you age, hot water affects your circulation differently. It causes your blood vessels to expand rapidly, which can drop your blood pressure suddenly. If you've ever felt lightheaded after a hot shower, this is why, and it's dangerous. You might enjoy that hot water because it feels good on sore muscles, but you're not connecting those dizzy feelings afterward to a serious fall risk. Keep your water lukewarm, between 98 to 100 degrees Fahrenheit. If it feels hot when you test it with your wrist, it's too hot for your safety. And speaking of timing, when you shower matters more than you think. Fact number 3, your morning shower routine is tripling your fall risk. Helen always showered right after getting up, it was her routine for decades. But at 74, she started feeling unsteady and confused after morning showers. Her body was trying to tell her something important. Your body needs 1 to 2 hours after waking up to get your blood pressure and circulation stable. If you shower too soon after getting up, you're asking your body to handle temperature changes before it's ready. You might think starting your day with a shower is energizing, but you could be setting yourself up for a dangerous fall. Try waiting at least an hour after waking before showering. Late morning or early afternoon might be safer times for you. Now here's something that might surprise you, how often you bathe is actually affecting your mental health. Fact number 4, your bathing routine is connected to your mood. Tom stopped wanting to bathe regularly at 74. His family thought he was giving up, but Tom told me he felt vulnerable and scared in the shower. Once we addressed his real concerns, his confidence and mood improved dramatically. Bathing can become emotionally challenging as you age, fear of falling, feeling vulnerable, or struggling with physical limitations. This stress can contribute to anxiety and depression. You might avoid bathing because it's become difficult or scary, but then feel ashamed about it. It's okay to modify your routine for comfort and safety. Consider shower chairs, grab bars, or even washcloth baths when full showers feel overwhelming. And if you're taking medications, which most of us are, this next fact is crucial. Fact number 5, your medications are changing how often you should bathe. Linda's doctor prescribed new blood pressure medication, and suddenly her usual weekly bath routine left her feeling weak and dizzy. Nobody told her that her medication would affect something as basic as bathing. If you take blood pressure medications, blood thinners, or diuretics, these affect how your body handles temperature changes and moisture loss. What used to be a safe bathing routine might now be too much for your medicated body. Your doctors probably didn't mention how your medications might affect daily activities like bathing. Ask your doctor or pharmacist how your medications might affect bathing. When in doubt, shorter, cooler baths are usually safer. But here's something important. Not bathing enough can actually be dangerous too. Fact number 6, underbathing is creating serious health risks. Grace, 81, reduced her bathing to once a week thinking she was protecting her skin. But she developed a painful infection that required hospitalization. The problem? Bacteria had built up in areas that needed regular attention. While overbathing damages your skin, underbathing allows harmful bacteria to grow in skin folds, under your breasts, and around your groin. If you have diabetes or other health conditions, these infections can become serious quickly. You might think less bathing is always better for your skin, but certain areas of your body need regular cleaning. Even on non-bathing days, clean your face, hands, underarms, and genital areas daily with gentle wipes or a washcloth. And here's the most important fact, one that could help you catch health problems early. Fact number 7, changes in your bathing habits signal health problems. David, 76, had always been meticulous about hygiene until he suddenly lost interest in bathing. His family was frustrated, but this change was actually an early warning sign of cognitive decline that led to proper medical care. If you find yourself suddenly avoiding baths, forgetting to bathe, or bathing much more or less than usual, this could signal depression, cognitive changes, mobility problems, or other health issues. Your brain and body are connected in ways that show up in daily habits. You might think changes in your routine are just part of getting older, but sudden changes in bathing habits often mean something important is happening with your health. Pay attention to your own patterns and talk to your doctor about any changes you notice. I know this is a lot of information, but understanding these facts gives you power. I understand this might feel overwhelming. Maybe you're realizing your current routine isn't working, or you're worried about changes you've noticed in yourself. It's natural to feel frustrated when something as simple as bathing becomes complicated. But here's what I want you to understand, you have the power to make informed choices about your own care. Every fact I've shared gives you the knowledge to make your bathing routine safer and more comfortable. You're not helpless, you're informed. If you've recognized any of these issues in your own routine, you can make changes starting today. Adjust your water temperature, change your timing, or talk to your doctor about how your medications might be affecting you. Getting older brings challenges, but it also brings wisdom. You've earned the right to adapt your routines to work better for your current needs. Taking care of yourself isn't vanity, it's wisdom. Let's recap those 7 facts. Daily bathing may now harm your skin, hot water increases fall risk, morning showers can be dangerous, your routine affects your mood, medications change your needs, some areas need daily attention, and changes in habits can signal health issues. You now have the knowledge to make better choices for your own well-being. I'd love to hear from you, which of these facts surprised you most? Have you noticed any of these issues in your own bathing routine? And for those watching this for a loved one, what changes have you observed? Share your experiences below, your insights help our entire community learn from each other. If this video helped you understand your own health better, please give it a thumbs up and subscribe to Elderly Health Central. We're here to provide the health information you need and deserve at every stage of life. Your support helps us reach more people who need this guidance. Thank you for taking the time to learn about your own health. You matter, your comfort matters, and your safety matters. Keep asking questions, keep learning, and I'll see you in the next video where we'll cover more essential health information for your best years ahead. Remember, small changes in your bathing routine can make a big difference in how you feel every day. You've got this.